So our today's lecture topic is gunshot wounds to the extremities. So according to modern literature sources, gunshot wounds to the extremities in the structure of all localizations about 64%. Because we can compare with a war in Chechnya that was previously like 20 years ago, yes. And we can see that in this structure, injuries of extremities increase. This increment is a proportion, is because of improvements of personal protective equipment, different armor, etc. And when we will compare wounds to injuries of soft tissues and bones, you can see that gunshot fractures start from 25% to 35% from all localizations. And what is the typicality? Complications in the treatment of such patients are associated with an increasement of the severity of injuries due to the constant modernization of weapons. High number of infectious complications associated with the features of the gunshot wounds and its areas are like 32%. There's all infectious complications. And also it has a higher number of non-union subductosis, and almost every gunshot fracture has bone defect more than almost every gunshot fracture has bone defect, and bone defects more than 3 centimeters are in 11% of patients. So we have our own statistics. It's like the same as literature sources. Okay, and when we speak in the treatment of gunshot wounds, is important about always life-saving. Most patients with gunshot skeletal polytrauma may have a problem in the form of hemorrhagic shock. So we need to provide appropriate management and resuscitation if it's necessary. And primary surgical treatment of such patients different from non-gunshot. So difference in volumes of antiseptics. So you must know a rule that if you want to clean this wound, you must take not less than 10 liters of aqueous antiseptic, for example, chlorhexidine or decasan. And if you have small bone fragments, you must remove them if these fragments are not associated with soft tissues. And you must provide fasciotomy. Fasciotomy performed for the prevention of compartment syndrome as the main complication of every gunshot wounds and fractures. So a few words about compartment syndrome. So compartment syndrome is a physiological condition when the increase in pressure in closed fascial increased pressure in compartments leads to a decrease in tissue perfusion below the critical value, which causes a decrease in oxygen in the tissue and ischemia and necrosis. So how to diagnose the compartment syndrome? There are two ways. It's clinical and instrumental investigation. Clinical, it's rule of 4P. It's pain. First of all, pain is severe and don't correspond with the severity of injury. So pain is much higher than the severity of injury. Pale skin because of ischemia, paralysis, and paresthesia is the stages of neurological complications. So actually, you could provide this measuring using different hardware, and when the pressure is above 30 millimeters of hydrogen stage, we must provide fasciotomy. So there are different ways of treatment. There are some conservative ways. So first of all, we must eliminate the etiological factor. We must provide the position of the limb at the level of the heart. So you must provide drug therapy, first of all, diuretics, and surgical fasciotomy. If you have not enough time for additional examination, you can provide a prophylactic fasciotomy, and you must provide fasciotomy for every patient when this patient is in a coma. Actually, usually all the gunshot fractures are initially fixed by external fixation devices. For example, in this picture, they are optimal due to the speed of the installation and the quality of fixation. But however, after wound healing, it's more rational to perform internal fixation with plate or nail and providing a bone plastic or bone defect if it's present, in case of its presence. Such operations are possible just in case of satisfactory results of laboratory parameters of blood. For example, first of all, C-reactive proteins, serotonin, leukocyte level, and etc. Various modern treatments, such as negative pressure wound therapy and ultrasonic cavitation, are used to treat gunshot wounds. So here you can see the surgical treatment of the patient using ultrasonic wound debridement. Why it's effective? Because it can selectively clean necrotized tissues and destruct the microbial biofilms. Because microbial biofilms is a main term that microbes are resistant to our antibiotics. So on this pictures, you can see a difference between wound before ultrasonic cavitation and after it. Also, you could provide negative pressure wound therapy. It's also a very effective way of treatment of big wounds. And the indications for using of negative pressure wound therapy, actually VAC, it's like a trademark American of KCI. So a method called negative pressure wound therapy. So indication for use of it is open wounds and purulent necrotic diseases and burns. And you could provide this operation due to local anesthesia, for example, and you're not allowed to use it close to neurovascular bundles. And the first time you could place these films of negative pressure therapy for 2 to 3 days, but not longer than 5 days, because it can get opposite effect of this method, because this film and this foam can be affected by microorganisms, so you must remove it. And actually, we have our study that we investigate various combinations of wound treatment, and it was found that the most effective scheme is the use of ultrasonic cavitation and negative pressure therapy. On this X-ray, this is a clinical example of stage surgical treatment. For see a patient with gunshot fracture of the humerus. So first of all, we provided external rod fixation. We cleaned the wound. We provided outer dermoplasty and provided plating. As I told on the previous lesson, that injuries that are close to elbow has a problem with contracture of elbow joint. So you could see contracture in this patient, but we had full consolidation. We had union of this fracture. Another clinical example of gunshot injury of a tibia, external rod fixation, big wound, stage treatment. We provided nailing, and this patient got great functional results. Also, if you want to ask how to treat big defects, you could provide different plastics of this defect. Very widespread way is the treatment using transplanted with vessels, vascularized, transplanted from musculus latissimus dorsi, just from your back, and you could provide a closing of big defect. Take a look at this defect. We took transplanted bone parts, and we provided a closing of this defect, and you could see functional results of it. It's much better, and this patient got a function. Also, a clinical example of treatment of big gunshot wound. We provide a few weeks using negative pressure wound therapy, outer dermoplastics, nailing, and this is a functional result after 2 months after operation. Not bad, and patient has a good functional result. Another one clinical example. So in this case, surgeon took preferred plating, but in this case, it's much better to provide nailing. And you could see functional result after 2 months after operation. In this case, we got length, shortening of length of patient leg. Another clinical example of stage surgical treatment of big area, and if I could take a look, we got good functional results. It's an example of treatment of patients with gunshot injury of femur. We provided nailing, mechanotherapy, and also interesting functional results. Another one patient with femoral fracture, also nailing, also good result. It's a result after 1 month after trauma. Another patient with multiple fracture of one extremity. So take a look, we provided 2 plates, and this patient got not very well functional result. It's result after 3 months after operation. Okay. And on this X-ray, take a look. We have neuropathy of radial nerves, and we had a big bone defect. In this case, we provided big surgery. We provided neurosis of radial nerve, and we closed bone defect with transplanted from tibia. And we provided plastics using transplanted from musculus latissimus dorsi. And take a look. Okay, we got great functional result in the union. It's also one clinical example of stage treatment. So we provided external rod fixation. We call the bone defect using PRF, it's a fibrin sealant with sponge bone. And we got union after 1 year after this trauma. Good functional result. So as a conclusion, the treatment of gunshot fractures must be comprehensive and well-loved. And you must learn that almost every gunshot injury must be treated using fasciotomy. And thank you for attention.